Well, thank you very much, Dr. Taub. It's very interesting to hear about your work, and I just have a couple of follow-up questions. And one is, of all the years that you have worked with patients, roughly how many have gained a normal level of functioning so they can operate in daily life and sort of forget about their stroke?
Our objective is not to produce normal movement, and we usually don't. Our objective is to produce a substantial improvement in the use of an affected extremity affected by the damage to the central nervous system, by stroke, by traumatic brain injury, by cerebral palsy, multiple sclerosis, spinal cord injury. And we are able to produce a clinically meaningful improvement in well over 95% of the patients that we work with.
That's very impressive.
We don't, our goal is not to produce normal movement. And we tell all of our patients, when they first come, they perhaps read some articles about the work that we've done in our laboratory and clinic. They have in their mind that when they leave, they're going to be able to play tennis or golf or go fishing. A few of our patients have actually been able to do that. We never talk about it because you can get patients who have an extraordinarily good clinical outcome and they leave feeling enormously dissatisfied because their idea was that when after they had gotten the treatment administered in our laboratory or clinic, they would be back to normal. So we always caution them that that is not our objective. Our objective is to improve their movement. Nevertheless, no matter, we can talk ourselves blue in the face, and when they leave with, sometimes, not often any longer, with an excellent result, they're dissatisfied because they can't go back and play table tennis. But is your question how many patients have returned to normal? Or
how many have improved significantly, clinical significant improvement?
We've worked with over 1,000 patients with stroke in our clinic and laboratory over the last 26 years. And virtually 100% of this, 97%, have improved substantially. Every once in a while you get someone who has emotional problems and they refuse to carry out the treatment exercises, or they're going through some emotional difficulty, but no more than 3% of our patients do not show a clinically meaningful improvement. We've also worked with, at this point, over 400 children, young children, well, children from 18 months all the way through the age spectrum, going through adolescence, with cerebral palsy due to various causes. And again, almost 100% of them improved very substantially.